Hey everybody, and welcome to your Montgomery County update for the week. Today's March 8th, and I'm here as always with Public Health Director Sarah Baranko and our Sheriff Jeff Smith. And it certainly is still obviously an ongoing difficult situation, but there's a lot of good signs and good things that indicate we're heading in a good direction. So I'm excited about that. We'll get into a little bit of it right now. The first, we like to start out with where we are with positive cases. Things have continued to the downward trend. We're down to 79 for this past week, which is down from last week, which was 80. And, we've seen since January, we were up in a few hundred a week. I think we were even over 400 a week at one point. To now really see that come down, which is nice. Obviously, still, need to be mindful. I know some areas are, dealing with different issues. I know even outside of the county in the local area, some of the school districts have had some challenges. But in general, it doesn't mean everything's perfect. Things are heading in the right direction. So that's some good news. Secondly, to date, Montgomery County Public Health has administered 1,844 first doses and 692 second doses. Of that, 108 have been Pfizer and 1,736 have been Moderna. So that's been going well. Anything we've been getting out. And I wanted to take a few minutes to touch on the Office for the Aging and how that's going to work and how it is working. So I just spoke with Dave actually a couple times already this morning. And he had a lot of similar challenges that we had at the county, and it wasn't, they're more logistical in nature. When you get that many calls, it's just your voicemail boxes and things of that nature are just not, prepared to handle 500 voicemails at a time. But anyway, they're working through all that, and their staff has been doing a great job. And right now they're working on getting that first 1,000 registered for the March 16th event. And just to give people an idea on how this worked. So you get your normal allotments from the state that come to our public health department. On top of that, you have the allotments that are given directly to the pharmacies. And just like you've seen at Price Chopper, at Walgreens, and things of that nature. And this is actually separate. So what we did was when we put together the wait list, it was actually turned out to be an additional benefit because when Dave was meeting with his colleagues, Aging New York, and there was a discussion with Kinney Drugs, and not just the Kinney Drugs from St. Johnsville, corporate, and they were, talking about vaccinating seniors and the need and things of that nature. They said, we have this big wait list, and that was really the opportunity for Dave. We had some discussions to make that big request of 4,000 shots. So they've gone through our wait list and, are getting rid of people that, may have already gotten their shot, looking at just 65 plus. And right now they've identified about 2,200 that are ready to go. So the good news is, once we get through that 2,200, then there's still going to be shots left. And, we got some interesting ideas on how to reach people that may not have been reached yet. Sheriff, we've talked about using potentially the hyper-reach system to help get the word out there. But the good news is right now, on top of what we're doing, on top of what the pharmacies are doing, now we have this added benefit of the 4,000. So our role is to really support the Office for the Aging in this initiative, and whether that be guidance, people. I offered today to Dave, if you need any help, you need to bring the reinforcements in on the phones, let us know. He said they're all doing a great job. They're actually really enjoying the work. It's very meaningful work. So things are looking up on the vaccination front.
And if I can just
Yeah,
interrupt,
go ahead.
the other partner that we have included in this is Centro Cívico
Yep.
down in Amsterdam. So the folks who are bilingual and Spanish speaking only, Alberto and his team have 6 folks down on Centro Civico who are taking care of calling our Latino population. So we have also brought in another partnership, and I think you and the sheriff and I had this conversation about that's what this initiative is. It's really about bringing our community partners together, and everybody has said, when you need help, let us know. And so we've said, now we need help, and everybody's getting together and really making sure that those target populations are being reached.
Yeah, it's going to be, I mean, just the thought of getting through that wait list is just such a relief. And they've been doing a great job. So,
Absolutely.
yeah, so those are the big items for today. Also, I've been getting calls from some elected officials about opening up parks and things of that nature, which is, it's going to be nicer later this week. It's really, I think this year is going to be a lot better than people had expected. Also, we saw over the weekend, I know you're always a fan, you're always there, the Amsterdam Mohawks announced that they're going to be playing, and they're actually going to have the college kids. So I think there's a lot to be, certainly positive about as we go forward, and we'll be answering a lot of calls from people as related to what the state does with, any type of restrictions. We've been in the same place we've been in for a while now with their guidance, but I imagine it will change again. But also at the same time, you're dealing with tough issues. I had some conversations with someone who, has a loved one in the hospital and can't visit, so those issues still remain. I do think, as we go through this year, it's time to start opening things up. We got it at the nursing homes, and hopefully, that'll be something that'll really, when it happens, ease people's concerns. We've all been there, with loved ones that we can't see. So it stinks. It really stinks. Sheriff, you got any updates? I haven't seen too many pause complaints.
No, we just had one over the weekend, but for the most part, as these executive orders change, right, it's hard to stay on top of all the changes.
You
So,
have to adjust.
yeah, we encourage people to pay attention to what's most current and, do your best to follow them the best that you can, because we want to keep these numbers decreasing.
Yep.
But I agree with you, as things open up and people can get outside, and there's already been massive changes that allow more people to gather and, and go to restaurants and things like that. So that's a win-win for all of us.
People are just so happy to see each other.
Yeah.
I've certainly experienced that in my personal life, just getting out and about. People are more than ever happy to see each other.
Plus, it's a long winter, so it's a win-win right now.
Exactly.
Winter's coming to a close. And
if we remember from last year, really the spring, at end of the spring and the summer, things went pretty well.
Yeah, things were
so
down.
I'm really optimistic about this year, and getting through the tail end of the worst of it, and hopefully having a good year.
Almost a full year.
Yes.
Next week will be 1 year.
Yeah.
It's been a long year, and when you think back to it, the first thing was the lockdowns and the restrictions, and trying to make sure everyone was on board with that, and then you went into a real emphasis on testing and tracing, and we've been through 2 different spikes. It's been a wild year, but everybody's really pulled together. Also, before I don't want to make sure I don't forget. Just wanted to say to all the women out there, happy International Women's Day. I know we all have some special people in our lives that, certainly, you want to highlight or thank. Sheriff, I thought your words today on social media were perfect. Sarah, you're certainly one of those women for me, taking on a leadership role like this and dealing with all the adversity and, a lot of angry people. There's people that are upset, and a lot of times it's no fault of your own. It's just the situation, and you've handled it with grace. You've handled it with just a big old smile most of the time, and we're all really proud of you. And there's a lot of those people at the county that I would like to thank. Certainly some in leadership positions, like our personnel officer, like our county attorney, that certainly deserve a good job and some recognition. So to everyone out there, thank you, and keep fighting the fight, and keep up the good work. So Morgan, do you have any other updates?
I just want to talk a little bit about what this week looks like for us. Today, when I leave here, we have a very small vaccine clinic that we're doing in Amsterdam at Centro Civico with the Latino population. That'll be happening today. That's why we moved to this morning. Tomorrow, Tuesday, Wednesday, and Thursday. Tuesday and Wednesday are our second dose pods, and then on Thursday, we'll be holding a first dose pod that has been designated as essential staff. But what we are doing this week is we're going to accommodate some of our folks that work until 4 or 5 o'clock, and we'll be having that later in the evening. So we are now working around adjusting our hours for our vaccine clinic. So that, again, is for essential workers. So we will be targeting the rest of our law enforcement, the rest of our healthcare workers. This week, my focus is really going to be trying to get those who do home care in. We have a list of those who specifically take care of seniors and through hospice and do direct care in homes. So those will be the first two groups that we need to target. And then from there, we're going to get in some other categories of essential workers. I haven't exactly had a chance this morning, just because of the way it's gone, to look at what we are being asked, but we'll be working through some of our essential designation. And, when you talk about women, there's a little girl who I know every week watches us with her mom after school. So I just wanted to say hi, Kimora. She is a leader in the making. So I want to say hello to her and her mom.
That's awesome. Just to touch on what you said, I actually ran into Alberto this weekend. We were actually pumping gas, and he deserves a big thank you too for everything he's done. Just a great guy, and helping piece together the vaccines with some of our populations. You need people like that, so he's been great, and he's always smiling.
Absolutely, he's the happiest person I know.
Yes, indeed. Yeah, good. I think that's about it. We got questions?
When will Montgomery County lift a domestic travel ban for vaccinated people so quarantine won't be needed? I'm told each county has to issue the ban to be lifted. Thank you.
So we actually don't have that in writing. I know it's on the CDC website, but we can't lift that ban until we have the order from New York State Department of Health. So I know there's a lot of stuff going on right now in the governor's office, but as soon as that's handed down from the chamber to the commissioner of the Department of Health, then we will be able to issue that guidance. We have asked for it. This will be week 2 that I've asked on our state call as to when that will be coming, and we don't have an answer. So there's also going to be some caveats with that travel ban. You have to remember you're only going to be allowed to travel for 90 days after your second dose allocation. So I keep saying to people, if you've been vaccinated and your second dose was on March 1st, for example, that travel is only going to be permitted without quarantine for 90 days. So you'll be able to travel in March, April, and May, and then come June 1st, you'll be expected at this point to start quarantining again after domestic travel. For international travel, there will still be a quarantine required, irregardless of vaccine status. So that change will only be for domestic travel at this point.
Yeah, and probably once everybody gets to understand what this is, the state will change it again.
Absolutely.
And I think you've touched on a good point. It's really the whole process has been difficult at times, to put it nicely, with the state, and lately it certainly hasn't gotten any better. And a lot of local public health departments are kind of feeling the same way you are. And I've spoken to a number of people where it just some of these things just don't pass the smell test, and it's very frustrating. But what else we got?
What kind of arrangements did we have to make with Kenny to administer the shot?
You need to call OFA. So
Yes.
You need to call for Office for the Aging, and I believe the phone number off the top of my head is 843-2500.
No, that's
That's
WCSS.
I know the radio
The sheriff
station
will
number
pull
off
it
the top
up.
of my
No,
head.
but
We'll get you the number.
Yeah,
for
it's got to
OFA.
be, so they're doing the registrations right now, and they're signing you up, they're giving you a time. Actually got a call from a woman this morning that forgot her time and was having trouble getting through because there's so many calls going through, but we're going to get that information for her. But yeah, just the office for
843-2300.
Yeah,
I
it
was
was close.
close.
843-2300 is the number. And just like we expressed when, we were getting, 5,000 calls in a day, just be patient. They're doing the best they can. And the good news is, with 2,200, that we know we have, with 4,000 potential shots, if the people want one, they're going to be able to get one. So that was a big relief. But 843.
And it is 65 and older.
Yes, correct.
843-2300.
What is the reasoning we can't watch our children play outside school sports? It's outside and we can social distance. We've been able to watch indoors since November or before.
No, I gave the go-ahead for outdoor sports spectators, so I'm not sure. Basically, what's going to happen is the school districts, and this is what is happening all over the capital region, is each student gets 2 lanyards and they can give it to 2 people. That way, they're just keeping an eye on the numbers. That's the way the school district superintendents wanted to handle it, but I don't know of that situation where you're going to have an outdoor sport where you can't watch. So
There is capacity issues. I mean, there's
yeah,
still
capacity, but every kid,
restrictions.
every kid will have the opportunity to have
bring
their parents
spectators.
or whoever they designate to watch sports.
So the person who asked about Kinney's, I think that they're asking what kind of arrangements did we make for Kinney to administer the shots, like as in, we're not giving them our allocation to Kinney's to vaccinate.
Yeah,
No.
correct. So
Okay.
so the way this is Kinney's is working directly to get the vaccine and to do the shots. What they needed help with was
Finding bodies to
finding
vaccinate.
the people to vaccinate, also security, finding a location. We're going to do the school in St. Johnsville as well as the Hageman Volunteer Fire Department. We think those are excellent locations. And then any assistance with the registration process and some of the logistics that we've talked about now. So basically, it was an opportunity for us, meaning us as a county, to access more vaccine outside of the traditional methods we've been able to vaccinate. So, I've said it before, it's not like we can just go on the market and buy vaccine. You only get what the state gives you, and you can kick and scream, you can ask for 5,000 a week. The bottom line is they're going to send you what they're going to send you. They've been doing it based on population. So small rural counties, people have heard me say this till I'm blue in the face, are only getting 100 or 200 a week for most of the time, and it just didn't, and we didn't know, and it's week to week. So now it's easy to look back and be like, this is what it was. But week to week, we didn't know if the next week was going to be more, the next week was going to be more, and the supply really stalled there for a while. But thank goodness it's starting to kick in, and you're starting to see those numbers go up big time. So it was just a way for everybody to pull together and bring 4,000 doses into Montgomery County.
The other thing I want to just tell people here is we were picked by Kinney's corporate. There were 7 counties throughout New York State that were picked by Kinney's corporate who have the reputation for doing vaccine clinics well and having the manpower and the policies and programs in place. So we were one of 7 counties that Kinney's and OFA at the state picked. Some of the other smaller counties were Seneca County, Warren County, but we were picked by a corporation.
Well, and that also went to, and in talking to Dave, they were really also, we had that wait list ready to go.
Absolutely,
that
because
was a
we've
big
been
piece of
prepared
it.
for this.
Yeah, that was a big piece of it. So the whole goal is to get shots into people quickly, and that's what's happening.
What about seniors that can't get out of their homes to receive the shot?
That is still a big challenge, and it's not one that's easily handled, and we're still working on it.
And there is a process. So and if you want to go into homes and administer the vaccine, there is an application and a process that you have to work with through the state. And at this point, we don't have that approval from the state to go into homes and transport vaccine. We don't have that at this point. We're working on it. We've done everything we need to do on our end so that we can do that when the state comes to us and says, okay, go, but we are just waiting.
Yeah, we've also had some talks with City of Amsterdam, and Tony Agresta has been doing a great job staying on top of that detail.
How long until students can receive vaccine?
You have to be 18 at this point. Moderna and Pfizer are only approved for 18 and over.
If you work in retail, when do you see us being able to receive the shot?
You are in our group B, but you are, I think, depending on what retail, so grocery store is a step higher than things like clothing stores. So if you do work in a grocery store, we have had several grocery stores who have approached us and asked us to vaccinate some of their folks because typically people who work in grocery stores are either the younger population or they're the folks who are a little bit older and they're retired and they work part-time. So we have been working with a few of our grocery stores to vaccinate that population.
With outdoor sports, can students go as fans or will they be counted as one of the 2 fan limit per player?
Yes, They will be counted
They
as
will be
one.
counted?
Yes.
Okay.
So students cannot go as spectators. They have to be part of that players allocation.
Yeah, and I imagine there might be some subtle differences between district to district, but in the conversations I had with the superintendent, they said they were just going to allocate 2 per person, but they didn't say anything to me about, so.
So maybe, maybe Sarah could clarify, because I had a parent ask me, if they have a family of 4,
Yes.
they're only given 2, but what if a student athlete only is using 1? Can that other one be used for that family?
They can, yes.
Okay.
So if you only have one person that can come because mom or dad works during that time, you can use your lanyard or your spot for somebody else. This worked really well last year when we had the Mohawks play. Brian Spagnola and his team, they had a really seamless process. So I'm hoping that we'll be able to follow that same protocol with school sports because it worked so well for a huge event such as the Mohawks.
Yeah, and it just makes sense. That's what, most districts, like I said, in Section 2 are doing.
What about a retail store like Lowe's department store?
I don't have an answer without looking at my matrix. I'm sorry. I can have that information for us to post later, but I'm not sure where they are.
Thank you for doing an outstanding job taking care of the county. Sarah, I will forever be grateful for you, and Jessica, since day one. You are amazing, and we as a county are fortunate to have you all as our leaders.
Aw.
Is that my friend TB?
I think so.
Thank you, TB, and happy anniversary.
Any other questions?
Someone said clinical trials are now taking place for 12-year-olds and up.
Oh, there you go.
Okay.
I mean, you knew it would happen.
Yeah.
But, I actually spoke to a parent last week who was interested in getting their children vaccinated. We had a nice talk about it.
Hate to ask, but masks, they still need to be used?
I think, again, it's a point of frustration, but I don't think there's going to be any lift in the mask mandate in New York anytime soon.
And I do know other states have said no longer needing masks,
Yeah.
but that's not something that we can override here. If
Yeah.
that's coming from the state level, then we
Yeah.
can't say we're not going to do that.
Yeah.
And maybe just briefly explain that, how the state tells us who we're able to vaccinate one more time and
Yes.
the groups.
So at the beginning, every Sunday night, usually at about 1 o'clock in the morning, I get a state-generated letter from New York State Department of Health Vaccine Division. And it is clear. It'll say you have 200 doses. And it'll tell me what category specifically and who within that category I need to target for the week. So for example, a couple of weeks ago, our state allocation was specific for those who were living or working with folks under the OPWDD, Office of People with Developmental Disabilities. So then we partnered with Liberty and Lexington and some of our other local ARCs throughout the region to target specifically those who were patients in a facility, who lived in a congregate care setting, or those who worked in a congregate care setting. So we knew specifically what that was. The following week after that, we were told we specifically had to target corrections, law enforcement, EMTs, fire departments. After that, we also have had to target school personnel, not just teachers, but cafeteria, teachers, bus drivers. And then finally, one of our other targets that was specific was livery drivers and medical transport drivers. So we partnered with some of our medical transportation companies, some of our local cab companies who transport people to and from medical appointments, especially places to like the dialysis center and the cancer center. We have to target those
Like
folks. Access. So we are very specifically told in that 1A, 1B, what the categories we are expected to reach out to are.
Yeah. So not only are they micromanaging what you get, but how you do it. Again, that's where a lot of the frustration comes in.
When will you open up for shots for people under 65 who have underlying health conditions?
As soon as I get vaccine for comorbidities, I've been told. So here's another little caveat. So 2 weeks ago, if you wanted to start vaccinating folks with comorbidities, you had to fill out a CDC form and submit it to the CDC. So we had to have our medical director and the county executive sign off on that. So Jessica and I spent about 2 hours filling out a form with all of our information, roughly how many vaccines we could get. We filled it out. Matt signed it. Our medical director signed it. We sent it to the CDC, and it was sent back to us stating based on the information we had been given, that we gave to the CDC, when we get allocation for comorbidities, they will allot us 100 doses for those with comorbidities. So that was 2 weeks ago that Matt signed that form, that we submitted it, then we got the return, and I still don't have 100 doses for those with comorbidities like I was told 2 weeks ago.
Yeah. Yep.
When will Fonda DMV open completely with no appointments needed?
I think hopefully soon. I know the problem, and I actually got this question earlier this morning. So same thing kind of with us. They are also operating under their requirements and guidance from state DMV. But we'll have to talk to the county clerk and maybe get an update on that. But I think certainly with the numbers going to where they are, that hopefully we can get back to that soon. We're good. Well, and even thinking, now we're in a good spot, but just a month or two ago, we were close to the public and cases were through the roof, and but we've come a long way, and I have a lot of certainly there's challenges, but I feel really good about the way the year's going, and things are going to start getting better, and hopefully people can, the whole mental portion of this has been really hard for a lot of people, and you see it in the messages, you see it in the anger. But we're going through a pandemic. This is a once in a lifetime thing, and hopefully, and we're about to come out on the other side. Yep.
What about carpenters that are working on schools that are open with staff and children? Are they considered essential?
If they are part of the school payroll, then yes, they would be. If they work for an independent business, I'm not sure where independent contractors fall. Again, I apologize, I don't have my matrix in front of me. I'd have to look at that. But if they're employed by the school, then they would be.
Good. All right. Well, everybody enjoyed the nice weather. It's going to be 60 degrees. People are going to start acting like it's Florida.
Are you ready to golf?
My neighbor said to me, maybe I'll open the pool next week. But anyway, so I think we're going to start to see things turn around. People will be smiling a little bit more, and
you and the sheriff will be out jogging, I'm sure,
I
this
don't
weekend.
know about that, but we'll see. But I hope everybody enjoys the week, and as always, if you got any questions, let us know, and if not, we'll see you back here next Monday. I don't think we have any holidays, right?
Nope.
All right. Take care, everybody.